In Uganda, mental health issues among adolescents are a significant concern. Approximately 22.9% of children and adolescents in Uganda are affected by some form of mental disorder. Depression and anxiety are particularly prevalent, with Uganda being ranked among the top 6 countries in Africa for depressive disorders, affecting 4.6% of the population. Additionally, 2.9% of Ugandans live with anxiety disorders. Focusing on Kasese district alone, the situation mirrors the national trends. Adolescents here face similar challenges with mental health issues, often caused by socio-economic factors and limited access to mental health services. Recent studies indicate that over 30% of adolescents in kasese have reported experiencing symptoms of depression and anxiety, and the use of prevalence substance disorders among adolescents in the region is estimated to be at 7.26%. The need for targeted interventions and support systems in the region is crucial to improving the mental health well-being among the youth. On 10th of November, the world has been celebrating the World Mental Health Day with the theme, "It is time to prioritize mental health in adolescents." While celebrating this day here in Kasese Municipality, Muhindo Joy, the health officer for Kasese Municipality, indicated that there is a need to support children in homes, especially those that are affected by domestic violence, because it has been indicated that many children are really tormented and tortured due to fights or domestic violence in homes where they live. This, among many other factors, lead to mental health disorders.
The people who are here and at the family level, the workplace level, we are the first whistleblowers. So whenever there is an opportunity to get information, let us embrace it so that we are able to identify mental health disorder at an early stage. Usually there are missed opportunities in identification, and then timely referral and link is not made. So please let us be ambassadors to early identification, referral and linkage to a nearest facility. We have been told at MSF, Kasese Municipal Health Center 3, Rukoki. I want to add that St. Paul equally has an established mental health clinic for both outpatient and inpatient care. And every health center 3 to hospital level, it has that corner for mental health. So let us utilize all these facilities so that we can get the support that is required. The risk factors for mental ill health are increasing, and they will not cease being. So the reason for us to be more vigilant, we have had relationships on the increase. You hear of domestic violence. It leaves those mental conflicts or factors that can progress to mental ill health. And there are various reasons for domestic violence. So the young people that are here, let us be aware of this, but also apply the knowledge and skills they have imparted upon you, how you can mitigate anything that would throw you into mental ill health. They have told us that the knowledge, sharing when you have something that will break you down. We know that personal losses or family loss can throw us into stress, depression, and other negative mental conditions. When you have lost your dear one, when you have lost all your property, like during these floodings, we know that they are very stressing times. You don't have a shelter and you have to be in a displaced camp or to be housed somewhere, sharing limited resources. Really, the stress causes are quite many. It's very unfortunate that in Uganda, we still have also violence in some schools, especially the boarding, silent teasing, and it has an impact. It's one of the causes also of post-traumatic stress. So it would be really good that in our schools, boarding schools, in our workplaces, the environments are made safe so that people do not encounter their risk to mental ill health from the workplaces, from the schools, and from our very own homes. And it means that we shall be ambassadors to discussions. When there is reason for disagreement or not agreeing, we apply those methods that can really resolve a conflict without getting to violent moments.
Mogi Chapman, the project coordinator, Medicine Sans Frontiers, indicated that there is a need for government and NGOs to come in the fight against mental health disorders among the youth.
Clinic here, we are providing service to our adolescent girls and boys. That's why focus is adolescent girls and boys. But of course, we have invited all relevant actors like school teachers, health workers, authorities. They are there, and we are very happy to organize this event to promote the World Health Mental Health Days and to promote for the adolescent girls. So normally what we do when we talk about mental health, this is not something we take very well. We think a taboo or we stigmatize someone with mental health. So we want to focus it. We want to promote that seeking mental health is not weakness, it's a strength, because mental health is equally important and essential as physical health. That's why we are promoting it, and this is very important for the adolescents because this is the age where they are having changes physically and mentally. So equally it is important and essential, and we believe that it will create some awareness in the community and the society so that we can take care of ourselves and our loved one. Thank you.
No, so which
Many statistics here actually, but very specifically to your answer, we conducted an anthropological study beginning of this year, and from there we found all these informations and statistics on the problem we have with the adolescent girls and boys.
Education. So please be able to identify risk factors and reduce falling victim of the risk factors for mental health. Should we have our relatives, our friends that have already become victims of mental ill health, let us support them. Let us identify where we can refer them for support, even if it is through the probation office, even if it is through the police, if it is through our health workers, if it is through our administrators, let us do so that they do not end up being wasted. It's painful to see a young person, even an adult, wasting at the streets, eating from, like maybe dustbins when they do have relatives. Even when somebody has mental ill health, if they are your relatives, love them, call them by name, attach them to care centers and support them so that in that state they feel that warmth and they are able within their mind to know that they can get better. Don't be one of those that will label them with the names. We label them with the names. Here in our local language, omraka watu omsire. Eshawaya kanishabiri wako. Let foreigners, let strangers label them, but as their relatives, love them, still respect them, support them to care for themselves, support them to take their medicines. Even for those at workplaces, we have had in-charges from various facilities.
Speaking to SP Luka Busa, who is the Community Liaison Officer for Rwenzori East Police, indicated that there is a need to fight mental health disorder among the youth in Kasese district and will be done by community leaders working together with family members.
Finding out what are the causes of mental health. One is the domestic violence in homes. You find that married couples, sometimes they have issues, and then in the process of solving them, it turns into chaos, fighting, boxing each other. And when they are doing it, with the fighting can never be secret. The children are watching as like a film. Then in the process, children begin thinking that they are very unfortunate because they have no way of solving their parents, since they are children and these are elder people. And when children begin thinking that they are unfortunate, that is what begin now torturing them. We find that they begin joining wrong groups, like the youth smoking opium, taking marijuana, and all that kind of thing. So the issue is domestic. Then another thing is, you see, like now, this is a municipal which is maintaining up to be a city. We have all the tribes in this country. They are here in Kasese. And now they saw being there is a lot of intermarriages. Women are being pregnated, and people who pregnant them, they even deny them, and we find that those children being born grow without a proper care of the parents. And that is what have resulted most children to go on the streets because they don't have care, neither the source where they come from is not known. You find a child doesn't know the proper father, maybe even the mother have abandoned her or him to the relatives, or some are even abandoned, they have nowhere to go. And then the mental health begin coming in. You see someone like a child, you find him behaving like a mad person because of that noble cause. However, now we have
health. Even when somebody has lost someone, know that they are going through a traumatic situation. People rush to the adults to offer them comforting words. But let us also remember the youth and the children that have lost their dear ones. When their performance and behavior at school change, please know that they are going through a healing moment. Instead of adding, trauma to them, get closer to them at schools. Get closer to them at workplaces so that they are supported to go through a healing moment. Even as health workers, if you identify that this one might be having early signs of mental ill health, love me and get to me. I personally do that quite a lot. you'll find somebody has said, this is a problem stuff. And you interact with them, you find they are going through a situation where they would need psychologist support. And just do that and keep it yourself. Don't just expose me, because that way you're not helping me to go through a healing.
Go on media like you have this medicine. They are really trying to make this awareness, and we have also integrated them as police, public relation office, to bring them to our free airtime on radios so that they continue talking to people about mental health. Maybe we can reduce them, but otherwise it has a lot of causes. So we want the community, where you find a family is having a domestic violence, suspect that mental health is going to be there. When you see children who are helpless and perhaps they don't have their parents, either they died, either they were abandoned, you should be able to report to police in office of CLO or PRO. We work hand in hand with the authority like the district probation officer to address those issues so that we can reduce mental health.
Substance of addiction on the increase, even among the young people, in schools, in homes. You will find some children on the streets. They are addicts of this substance of addiction. Some of them are pushed to the streets because there is violence in their homes, or there are no people to take care of them when their parents have had problems or passed on. This is a call to us adults, that when children lose their dear ones or have no one to support them, let us be accommodative. And then to the young people, right away in Kasese here, you find there is a heightened pregnancy. You, as the girl who's pregnant, you are not economically empowered. The boy that may be responsible is not economically empowered. It is also a source of stress. Or that adult who is responsible is not willing child you will bear. So it's a call that once you have an opportunity of being in school, please hang on until you complete, so that you can make a choice of somebody you want to be your husband or your wife, and you're able to provide for your children, and you're able to support them psychosocially. And